Hi, I'm Dafydd and today I'm going to be performing a knee examination as part of a Model 3 assessment. This is Endav, he's kindly agreed to be a patient. Today I'll be examining Endav's right knee, just for the sake of the assessment. He hasn't got any pain there or is not complaining of any symptoms there. So it's important to expose your patients adequately, make sure you have a good look at the knees and the quads as well. So now do you mind just bringing your shoulders a tiny bit up? Great, alright, so first of all we're having a look from the front, looking for any asymmetry, any abnormalities or any valgus or varus deformity, any obvious swelling, scarring or change in the colour of the skin. Great, alright, and do you mind just turning to the side there? There you go, okay. So looking at the sides we can assess for any fixed flexion deformity and again any obvious swelling or any scarring there. And we can also have a look at the back. Let's have a look at the back now. And here we can assess for any swelling in the popliteal area, and we can also look at the Achilles tendon and see if they're adequately aligned. That's fine. Okay. After having a good look, we can ask our patients to walk, just to assess their gait. So, I know, do you mind just walking backwards and forth? Right, and forwards. So we're looking for any antalgic gait and any abnormal alignment again. That's alright. Ideally you do this in a large area, but we're confined to our living room. Alright, that's great. If you don't mind having a seat on the couch. So again, we can have a more detailed look, see if there's any obvious swelling here or any scarring, and after that we can go on to the feel part of the assessment. So with leg in extension we can assess for any pain in the anterior compartments. First of all, I like to have a feel of the joint to assess the temperature and compare it with the surrounding areas. I always compare with the other joints as well. Okay, temperature seems fine there. Then we can have a look at the quads to assess for any wastings here. Good, and there seems to be good muscle bulk. You can also measure the size of the quads if you feel that there's any discrepancy between either legs. After having a feel of the bulk of the quads, first of all start palpating at the insertion of the quads, just superior to the superior pole of the patella, to see if there's any tendons of the quads tendon there. Any pain there? No. Oh, it's okay. Then you can have the feel of the patella and all around the border of the patella. Any pain there? Good. And then the patella tendon. Any pain there? No pain. Great, it's okay. And again, usually compared with the other knee. So do you mind just bending your knee now to 90 degrees on this one as well? Okay. So if we have a look from the sides here, we can assess for any posterior lag as a sign of damage to the posterior cruciate ligament. And you're looking for any drop of the tibia back on the femur, and that seems to be okay. I feel for the joint line in this position because it opens up the joint and the tendons are out of the way, so you get maximal feel of the joint line. So have you got any tenderness there? No. You can also have a feel of the femoral condyles. Any pain there? No. There. Any pain here? No. Good. And the head of the fibula there. Any pain there? No. Good. Okay. Alright, if you bring your knees back down like that, straighten them out. We can then assess for any effusion. So we can assess that by milking fluid down into the knee. And usually, if there's a significant effusion, you can see fluid bulge on the medial side. You can then sweep it from the medial side to the lateral side, and the fluid will then appear on the lateral side and then sweep it back to the medial side. And that doesn't have any effusion here. Another test for effusion is the patella test. So again, you'd milk the knee down here and just tap on the patella, and that'll be positive and moderate to large effusion, but there's no evident effusion there. After feel, we can move on to movement, and again we'll assess active and passive movements. So I like to start my examination of the knee by testing straight leg raise. and this assesses the extensor mechanism of the leg. So we can assess the quads tendon, the patella, and the patella tendon there. So I don't know if you'd mind just keeping your leg straight and just lift it off the bed. Excellent, okay. And put that down. And same again, this one. Excellent. Got any pain there?
No.
Okay. Now what I want you to do is to bend this knee as much as you can. All the way up, good. So assessing flexion there. And then straighten it out again, all the way. Good, okay. And bend this knee as far as you can, good, and straighten it out again. Good, okay. So good flexion on both sides. Now we're going to assess extension, so I'm going to place my hands behind end of knees, okay, and just press my hands into the sofa there. Good, okay, there's good power there. So after active movements, we assess passive movements. So I'll place one hand on the joints, and then I'm just going to do the same movement again. So I'll just get you up into a bit of flexion first. So again, assessing for any crepitus, and there's good movement there. And the same then with this one. There's a bit of a click there, a bit of crepitus. Okay. So after passive movements, we can assess the ligaments of the knee. So we've got the anterior cruciate ligament, posterior cruciate ligament, and the collateral ligaments. So if we start off by assessing the collateral ligaments, again we'll just concentrate on the right knee. Just get the knee into about 15 degrees of flexion. Okay, I'm just going to take the weight of your knee, alright, I'm just going to assess the big ligament that comes down here. And I'll be trying to stress that ligament, alright, tell me if you've got any pain at all. So by applying valgus force, we're assessing for any tenderness on the medial side. Any tendons there?
No.
Good, alright. So assessing medial collateral ligament there, and now we can apply varus force. Any tendons outside there?
No.
And there we're assessing lateral collateral ligament, but there seems to be no pain there. So after that, we can assess the cruciate ligaments. So if you don't mind just bending your knee to 90 degrees. Good, okay. I'm now going to sit on your foot. Do you have any pain in your foot?
No.
Good. Right, so securing the foot, I'm first going to perform the anterior draw test to see if there's any instability in the anterior cruciate ligament. So I'm going to just pull on your leg here, tell me if you've got any pain.
No.
Good, okay, and now we can assess the posterior cruciate ligament by doing the posterior draw test. It's pushed back. Good, and there's no instability there. You can also do Lachman's test for the anterior cruciate ligament. That's in about 30 degrees of flexion. You can rest your leg on your arm here and just pull forwards here. Okay, there doesn't seem to be any instability there. Alright, and that concludes my assessment of the knee. I'd also perform examination of the hip and the ankle and assess neurovascular status.